This is really
Dr. Yo, I
important.
hope you can hear
One of
me
the things that
because
we need to do is work with the community leaders. We have to work with people that these communities trust. A part of the Biden plan has really been to put local federal centers into areas of greatest need. In fact, Bronx has been the highest area in New York here, and they've just opened up Yankee Stadium. We're hoping to have more mobile units that actually go out into the communities. One of the problems with the disproportionate dosage of the vaccine has been that it's been primarily distributed through major academic and health centers, which are often in major cities and not in rural areas, harder for people to get to that don't have transportation. So again, working with these communities is going to be important. We need to go to community centers. We need to work within organizational structures such as groups. I know that one of the big plans from the Biden group has been to create a national health equity center. They've tapped actually a former colleague of mine, Dr. Marcela Nunez-Smith, to head this task force. And Dr. Nunez-Smith has been working in this field for nearly 20 years.
Well, that's good to know. Can you tell us anything about Dr. Nunez-Smith in terms of, do you think the approach that would be taken?
Yeah, I mean, I worked with her actually back in the early 2000s. One of the things that she's particularly well known for is working with community groups. A lot of times, as you know, the healthcare system does not have a long tradition or a good tradition of working with minorities in a open and integrative fashion. And so she did a lot of work in the early 2000s and beyond on community-based participatory work, as well as in studying national healthcare disparities in all different types of health problems.
Interesting. Well, she certainly has the skill set to handle this crisis. But tell us about your industry, the healthcare industry. There is a strain, we know, on the system because of COVID-19. Tell us what you're seeing and what you're experiencing, and if you think that that is going to be getting better anytime soon, this strain that we're seeing on
Yeah,
hospitals.
I haven't been hit as hard as many of my critical care colleagues, but I'll tell you, we've been dealing with this in New York since early March. I got COVID in early March and was not then reverted to taking care of the COVID patients early. But once I did come back, I've been taking care of and helping out. As you know, all the healthcare systems are trying to help out now, taking care of these patients. We aren't at the levels that we were at in New York in early March, but nationally, the healthcare system has really been pushed and pushed and pushed. And as you say, after a year of this, I think it's really important that we have to start thinking about how this has affected healthcare professionals from a mental health standpoint in particular. And I also think it's important that we think about, there's already before this, we know there are healthcare disparities, and many of the preventative services have been on hold. And so I think it's important that we plan and make sure that we push forward and address not only COVID disparities, but as other healthcare problems are continuing to go on, we need to make sure to address those.
Well, Dr. Yo, we are out of time, but thank you so much for all you do as a healthcare professional. We're glad that you have recovered from COVID-19, and thank you so much for all the information you gave us today. We appreciate your time here on BNC Now.
Thanks so much.